Because look, I know guys who are like, let's say testosterone levels of between 300 to 1,000, right? That I said, and they're like 400. And I'm like, hey, how do you feel? Like, yeah, pretty good, man. I feel good. This, good. Libido, yeah, pretty good. You know, I'm not 20 years old, but this, all of those reasons, you do not need testosterone. Trust me, I'll tell you all the reasons why. It's going to make your life a living hell afterwards. It's something that once you start, you're probably never going to stop, and you can't stop. And I'll give you my own personal reasons behind that, my own personal experience in a little bit. So keep that in mind. Once you start, you're not going to want it. So I want you to start it only if it's your last resort. Keep that in mind. All drugs are used as a last resort, not as option one or maybe option two. Last options. I'm not here to make money off of you on giving you this testosterone and then, hey, afterwards you need Cialis and Viagra and HCG, and maybe I'll give you some hormone replacement therapy and give you some growth hormone and different peptides. And next, you know, you're walking out spending $500 a month. That's bull, all right? This isn't a clinic where I'm going to make thousands of dollars off of you. Just giving you all the experience because I don't want you to fail and get your ass handed to you and lose money and lose your health in the process, because these clinics are making thousands and thousands of dollars, including prescribing you anabolics such as oxandrolone, Anavar, or Winstrol, or Decadurabolin, and all these different things. So let's get that straight right now. How do you need it? Have the symptoms, and if you have blood tests, right? So if it's on the lower end, then that works. Now, let me give you my own personal experience with all of this.